afternoon and welcome to this special information session about the Masters of Science in Health Policy and Economics at Weill Cornell Medicine in New York City. My name is Arian Jung and I'm an Assistant Professor of Healthcare Policy and Research. I'm also the Director of the Masters in Health Policy and Economics.
And I'm Mark Unruh, Assistant Professor of Healthcare Policy and Research.
We are very excited to discuss our program with you today. If you have any questions during this presentation, please feel free to type them directly into the chat window on your screen, and Mark and I will answer them towards the end of the presentation. Additionally, we are recording today's webinar and we'll be posting it online later today. So feel free to come back to our site later and rewatch anything you may have missed. So before we begin, it's worth noting that there's still time to apply, but not much longer though. So we have had such a tremendous interest in our program this year that we had extended our application deadline to April 1st. So if you haven't yet started your application, there's still time, but you will need to start right away. Of course, please reach out to us to ensure we get everything on time. We will discuss the application process and help answer any questions you may have about it shortly. Mark, let's begin today's presentation by talking briefly about the history of our program.
Sure, Ariane. Let me give a little bit of background on our programs and our institution as well. Way back in 1898, Cornell University established Cornell Medical College. But unlike Cornell's main campus in Ithaca, New York, the medical college was founded in New York City due to the many clinical training opportunities that were available. Today, the college is affiliated with multiple New York City-based medical institutions, including New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, the Hospital for Special Surgery, the Rockefeller University, and many others. Then, in 1952, Cornell University founded its Graduate School of Medical Sciences and began to offer PhDs and other degrees. The institution was named Weill Cornell Medical College in 1998, and recently we officially became Weill Cornell Medicine to better represent the breadth and depth of everything we do best. That includes world-class patient care, cutting-edge research, and of course top-ranked education. And that brings us to today. The Department of Healthcare Policy and Research concentrates on studying and improving healthcare delivery to optimize the value of healthcare for patients across the country. Dr. Renu Kaushal, Department Chair, is an expert in healthcare quality, patient safety, and health information technology.
So our department has some of the strongest graduate programs in our field. We have an extremely diverse set of students and applicants, including those recently out of their undergraduate degrees program, medical fellows, and individuals in the field for 20 or more years. Today we will be discussing our master's program in health policy and economics, which can be completed in 1 year as a full-time student or in up to 2 years as a part-time student. Additionally, the program requires a research project or thesis, which we will discuss in more detail shortly. Our academic year is unique in that it is divided into 3 terms, fall, spring, and summer, covering 12 full months. Our master's program in health policy and economics is highly selective, and it trains the students to be leading policy analysts and researchers working to identify the most effective ways to organize, manage, and finance to deliver high-quality healthcare.
Here's an overview of the Health Policy and Economics curriculum. Our MS in Health Policy and Economics builds on a shared set of courses, highlighted in red on the screen, along with our master's program in health informatics. These shared courses provide training in how the healthcare delivery system functions, how to ask questions about these systems to better improve them, how to use statistics to develop and improve policies and healthcare intervention, and how to work with large healthcare data sets. As the name suggests, our health policy and economics specific courses, now highlighted in orange on the screen, provide a strong foundation in health policy and economics. Students will become well-versed in the financing of healthcare, economic components of the delivery system, and the role of government. understanding how incentives present in the nation's healthcare system, from ways that physicians and hospitals are reimbursed, to the regulatory requirements for the development and approval of new drugs and medical devices, influence the cost and quality of care is essential to keep up with the changing healthcare landscape and to provide the best care possible. Utilizing cutting-edge statistical approaches, our students learn to conduct rigorous analyses with healthcare data using computing packages such as SAS, Stata, and R. The results of these analyses allow them to better comprehend how changes in health policy and new interventions in the delivery of care may improve the health of people across the country.
And another unique aspect of our program is the research project. This is a required component that engages students in hands-on research projects that culminates in a thesis. Each student works with a faculty mentor who provides a training, helps identify and access healthcare data sets, and facilitate contact with the faculty and staff conducting research studies. So after completing their degree, our students have an opportunity as a researchers and policy analysts in the healthcare industry, federal and state health departments, research institutes, academia, and consulting firms. Employers in this field increasingly need individuals with advanced skills in analytics, economics, policy evaluation, decision science, and implementation science. And our alumni are well prepared for PhD programs if they wish to further pursue their studies. And of course, a degree in health policy economics from Weill Cornell is a tremendous asset for your career growth. One of our many successful alumni is Neha Patadia. Neha graduated in 2013 with an MS in Health Policy and Economics, and she's now working in Boston for SeniorLink, a healthcare startup whose mission is to work with alternatives to nursing homes through in-home healthcare and technology. As director of the data and analytics, she's in charge of developing her department's analytics and reporting for the entire company.
So let's talk now about the application process. The application is live for only a few more days. So if you haven't already started your application, now is definitely the time. Of course, please feel free to reach out to us at any time for help with any part of it. We require 3 letters of recommendation, but are able to begin reviewing your application once we receive the first letter. Your recommenders can send their letters directly to us by emailing hpr-education@med.cornell.edu. We'll put that email address up at the end of the presentation as well. We also require the latest official transcripts from your undergraduate institution, as well as any from graduate degrees that you may have completed. You'll also need to write a personal statement that describes your interest in healthcare and/or health policy and this program. Due to overwhelming interest this year, we announced an extension of our application deadline. Your applications are now due next Friday on April 1st. Again, that's April 1st. So be sure to get all of your documents to us as soon as possible.
So along with those requirements, simply submit the online application and the $60 application fee. You can, of course, reach out to us at any time to check on the status of your application. And 2 final notes about admission. We do not require standardized test scores for admission into our program. However, we do encourage you to submit them as they can help strengthen your application. Our applicants generally submit scores from the GRE, NCLEX, or GMAT. And if you are an international applicant, you'll need recent TOEFL or LTS scores.
In case you haven't had the opportunity to explore it, let's take a moment to look at our website. There's a lot of information that we invite you to check out, including more information about our program, faculty, upcoming events, and our application process. As we mentioned before, our application is live until April 1st. You can begin or continue on it by going here.
Great, thanks, Mark. And now let's go over a few questions that some of you submitted during our presentation.
So the first question is, are research topics only applied to U.S. health systems? I would say the majority of our faculty do research on the U.S. healthcare system, and our curriculum mainly focuses on the U.S. healthcare system, although the skills you would learn in data analysis and the finance of healthcare would be applicable to any healthcare system. And we do have faculty that are doing research on international topics. So feel free to reach out to us if you'd like more information about particular faculty members. Okay, we have another question here. What background do you require for this degree? Okay, wonderful question. So as mentioned earlier, we consider applicants from a variety of backgrounds, not just those who are, say, policy or economics majors as undergraduates. Our students typically enter from diverse backgrounds, they have different experiences and interests, including some who are in medical professions, others who have been in healthcare administration, public policy, population health, sociology, economics, and related areas. So just to give you an example, about a third of our current cohort entered the program directly after finishing their undergraduate degree programs, and they have some were economics majors, some were biology majors, some were psychology majors. So there's no specific background that we require. Then another third of our cohort consists of people who've been working in the field for quite a while, typically in the healthcare industry. And then we also have about the last third of our cohort consists mainly of medical fellows from the surrounding hospitals, New York Presbyterian and Memorial Sloan Kettering.
There's another question. Is this program too technical or require high quantitative skills or econ background? So the answer is no. Advanced quantitative skills or economic background is not needed. Our core courses, which you take in the first semester, will prepare you for quantitative course in the second and third semester. So for example, the core courses include introductory statistics and health economics. This will prepare students for a more advanced course in the program.
Okay, we have another question on the screen asking what facilities and resources are available to students. Wonderful question. So I think one thing to really emphasize, it may be a little different of our program, is that you'll be assigned to a faculty member right away. We try and match people as closely as possible based on their interests, and sometimes people do end up changing, but for the most part they stick with the initial mentor. But again, we are somewhat flexible on that. So your mentor can help you throughout the program. You'll meet with them regularly, have very close contact throughout the year if you're full-time or 2 years if you're part-time. They'll also help you with your thesis and can help guide you to a topic and also assist you in finding data and other resources. Additionally, all students entering the program will have a laptop computer, and you'll also have access to a variety of software, pretty much anything you can think of really, including SAS, Stata, R, MATLAB, Stat Transfer, Microsoft Office, and many other packages that I can't recall off the top of my head. And we also have staff specifically for the education program to assist you with any other needs you might have.
Yeah, of course you will have access to Weill Cornell Medical College libraries and student gyms and,
yeah.
and so on.
Yeah, that's true. Okay, and then someone is now asking, let's see, what do you mean by hands-on experience in data work? Okay, so for some courses, students will be given data sets and asked to complete assignments with them. The thesis also involves working on a project with data. So that's also another, I think, unique aspect about our program. So when you come in, you'll immediately start working with actual healthcare data. So when you take classes that deal with statistics or maybe teaching you how to manage healthcare data, you'll actually be working with healthcare data. Additionally, as we mentioned earlier, your thesis or capstone project will also deal with a topic that involves the use of healthcare data. So that looks great on your CV when you finish the program. And we have a lot of resources here in terms of data. So again, I think that's something very unique about our program.
So there's another question is asking what the difference between NPH and our program, Health Policy Economics. That's a really good question. There are some differences. For example, most NPH programs tend to place greater emphasis on population health or epidemiology and patterns of disease. So the NTH program also tended to be more theoretically oriented, while our HT program is more applied with a practice-based focus. Our program emphasizes a broader policy perspective to include payment policy, health insurance coverage, and structural issues related to the healthcare delivery system. So our goal is to prepare our students to work effectively in organizations in the related policy environment as a well-trained healthcare researcher with strong analytic skills.
Okay, so someone had a follow-up question to that. So asking about job prospects. So as Ariane mentioned earlier, after completion of the degree, students have many career opportunities, for example, as policy analysts in the healthcare industry, in government institutions, including federal and state health departments, research institutes, academic, and also consulting firms. So again, as you mentioned, these employers increasingly need individuals with advanced skills in analytics, economics, policy evaluation, additionally decision science and implementation science. So also students who want to pursue further studies after our master's program are well prepared for PhD programs in areas such as health services research or health policy or even public policy. And again, as I mentioned earlier, each student will be paired with a faculty mentor to help with their thesis, and they can also provide advice on their career path.
All right, there's another question asking about the collaboration opportunity. So being in the New York City is a huge asset for our program. So the local institutions collaborating with Weill Cornell Medical College include New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, and Hospital for Special Surgery, Rockefeller University, and the State Department of Health and New York City Department of Health and Mental Health, and more. We also have a very close ties to other departments within the medical college and university, as well as the Cornell Tech campus.
Okay, great. That seems like all the questions that people have for now. Great questions, everyone.
Well, Mark and I wish you to thank you for taking a few minutes to learn more about our Master's of Science in Health Policy and Economics. And please be sure to contact us with any question you may have, including the check on the status of your application. Best of luck. Thank you. Bye.
Take care, everyone.